Thank you, Empire, for having us as always. We're here just about every 2 weeks to cover a bunch of different educational topics in aesthetics, talking about our flagship product that met results, the Plexr. You've probably heard us talk about it before. And of course, we love having enlightening speakers that could not only teach us, but add color around the different treatments that we offer and the treatments that are coming, right? The treatments that we don't know about, that we'd love to learn about. And also today, the differences between what many of you have heard in our webinars before and other modalities like CO2 lasers. Chris Croley, doctor, welcome. Thank you so much for being here today.
You're welcome. It's a pleasure to be here, Jeffrey.
I wanted to ask you, I always do bios before
Sure.
these sessions, and you know, we're joined, we talked about last time, by different types of people on this call. People who are working in the emergency room, midnight shifts, they want to get out, they have a dream of opening up a med spa. We've got surgeons who have people in their chairs, they're just looking for new revenue opportunities, and people not in the space at all, and they're just thinking about it. So I always like to ask, what is your, hero origin story, I like to say, and and tell us something that we don't know about that story. It surprised us because a lot of people know you on this call, a lot of people don't. So yeah, so
Yeah.
so give us something tasty, something new that we're going to learn about you today,
Something new. That's a
and how
challenge.
you jumped into the space.
So it's a little bit of a challenge because I talk and tell this story often. So I'm gonna have to stretch a bit here to think about what these people don't know, some of them. So first of all, thanks everyone for joining us. I love looking over the registrant list and seeing who all on here I recognize a lot of the names. Believe it or not, Jeffrey, there's someone on that I did anesthesia residency with. So way back in the late 90s, early 2000s. And so long-term connections I see on here.
I love
So
that.
welcome, Don. I'm glad that you joined us on the call. And then I see someone here from Hawaii. So I wish, I was in Hawaii, one of my favorite places right now. So we have people from all over taking time out of their busy schedules to be with us. So thank you, thank you, thank you. For my story, so it is kind of interesting. So this space was not something that I actually had any long-term vision of entering. So I was an anesthesiologist, board certified in that and critical care medicine, practicing at a major academic center. So I had performed my residency at Rush University in Chicago, did my fellowship at Northwestern University, and went back to Rush. And there I was the associate director of the anesthesia residency program, the co-director of the Rush University Simulation Center, and the director of the surgical ICU there. So a lot of kind of leadership roles, but more in academic, traditional, as you would expect an anesthesiologist and critical care physician, what they would do. And my husband, Jerry, who is now a nurse practitioner, was relocating. And, we were at the point in our relationship where who was going to move where. And the decision was he was going to move to Chicago. And the laws were a little bit different. In Illinois, nurses, registered nurses could do injectables. And so he was thinking about this aesthetic field. And this is probably 16, almost 17 years ago now. And there was a class in Las Vegas, and I thought, I'll go hang out with you at the class. Vegas sounds like a fun weekend. And, if my mom or sisters want a little bit of Botox, maybe I'll go learn how to inject it. And so that was really my first introduction into aesthetics.
Hmm.
And, not thinking about it as a full-time career. I tell this story often in our business classes. At that point in time, I never envisioned aesthetics or injecting Botox and filler as being something that would replace my income as an anesthesiologist and intensivist. Obviously, I don't think it's a secret that that's a high paying specialty. And so to look at doing these injectables and think that I could have a whole career around this and really leave my primary jobs was not a thought. As years went by, I actually saw the potential and become a little more business savvy, started taking more business courses and learning how I could incorporate things with higher ROI or higher return on investment into my practice. So it wasn't just the injectables, but I was doing other things to really try to expand and scale the practice. And as we were successful with that, it became a bit of a challenge for me. It was fun. It's just as fun as learning the procedures was learning the business side and how we could make this work. which brings us to where we are today. And so our primary practice is just outside of Pensacola, Florida, and Pace. And it's a pretty large practice. I'm a trainer for a couple of national companies. And so I have the privilege of getting to go around and meet a lot of aesthetic providers and teach new people every year. And get to try out a lot of cutting edge technology and new devices. And so that's how I kind of got introduced to.
Make sure it's not me. Hold on. That's always fun. Thank you, everyone, for your patience during this technical intermission. Hold on, let me text him. He's probably relogging on.
Sorry about that, everyone.
He's going to jump on. So let me tell you a little bit about me, because we always talk about the presenter. So how did I get into this? I actually met Arash through my mother-in-law, which was a really, I've been an entrepreneur my whole life since the age of 16. And I started the first taxi sharing platform in New York, and I started a video caller ID company. So a lot of tech, a lot of consumer apps, mobility platforms. And, I couldn't help but notice after my wife had our kids going to these mom groups and baby music class and looking around the room, and I just noticed that a lot of the young adults in my communities were, they looked perfect. They looked like they had no wrinkles. They looked stunning. Everyone looked stunning. I'm in Los Angeles. And what I realized was there was this thriving community and technologies and platforms that offer people ways of making themselves look the way they want to look. For me, there seemed to be also like the dark side of the industry, and I really wanted to find a company that had a lot more soul and a lot more consciousness around this work. I think we see that in all types of businesses. And I met Arash, and he introduced me to Meta Results. And Meta Results as a company has been around for a very long time. In the States for, I think, since 2016, but he also has an international company for the last 25 years. And in the medical device space, in addition to several other products, he introduced me to the Plexr. The Plexr is this innovative device that really doesn't cause, what's up, Chris? I'm doing my monologue, so I'm going to finish my monologue.
There you go. All right.
It's a super interesting device that caught my eye, and it was so powerful in the way of the modality and not creating thermal damage. It's not like a laser, and that's the subject here, the difference between a laser and what plasma energy is, that it not only floored me, I jumped in. I jumped on the team. I run strategy here, and I have the amazing task of just figuring out what our roadmap looks like, how we present ourselves, training academies, webinars, and all of the ways we present ourselves to the world and how we grow. And it's been an honor and a pleasure to work with not only Arash, but to work with practitioners like Chris. So, why was this so impactful for me? And this is really where it's perfect lead into Chris to talk about the talk today, is that all I ever heard about was lasers until I met Arash and I learned about plasma. And my first question is, well, I saw plasma pens on Amazon for $200. And the response is always, that's not plasma. So Chris is going to dive a little bit deeper into this whole subject of like, what is plasma? What is CO2? What is popular? Why the difference? And probably shed light on why I decided to really jump in with my career with Meta Results and this team and people like Chris and the community at large. So Chris, perfect timing.
Well, I think as it got cut off, what I was saying, kind of the fun fact that maybe I was going to share with you guys that I think many people don't know. As I always say, one of my worst business decisions ever. So this is before I learned to become more business savvy, was actually the purchase of my first energy-based device, which was a CO2 laser. And
Mhm.
so I've been,
Yeah, there we go. There's
there
the
we go.
tie-in. Yeah, great job.
So, when I was approached about doing this particular topic, and I wasn't sure if Arash was going to be able to join us tonight or not, but I was very excited to talk about it because my first foray into energy-based devices, probably 13 years ago, I purchased a CO2 laser. And so I have quite a bit of experience with it because it's the only device that I owned for a while. And it was actually like horrifying. It was a bad business decision. And I have been incredibly, incredibly cautious about bringing any energy-based device into my practice since then. So in fact, we didn't buy another one for many years because I thought, how did I make such a bad decision? Since then, I'm much more careful about what we bring into the practice, and we do have a lot of different devices now, including a newer version of the CO2 laser.
Hmm.
And so I love to talk about the differences and compare the differences because, there's still some things that one may be better suited for than the other. But having experience with both modalities over the years, I can tell you that the Plexr will fit much more readily into everybody's practice. And by the way, for everybody on this call, I don't get any money if you buy a Plexr. So I'm going to tell you my personal experience with it and how I love it. I do obviously get paid to do these talks for the company, but I'm not getting any kickbacks from anything that you buy from them. And so this is really, truly for your knowledge. And so I will go through my experience with this. I'm going to go over the technologies and what's different between them. But I'm here for you. And this is the way you're going to get the most out of this is to ask a lot of questions. And so put your questions in the Q&A box. I'm going to go through the presentations. We have plenty of time at the end. We're going to make sure we get every question answered. If it's something that we don't have the answer to readily, we will get back to you on that. So put what you want to know in that Q&A section, and we'll really have a fun night. Jeffrey, if it's okay, I'm going to go on and
Yeah,
take the
over to you,
screen.
my friend.
All right, good deal. Let me share the screen here. All right. Okay, I mean, you guys know this about me. One thing I didn't mention, if you want to hear more about kind of my thoughts on some devices and things that are coming out, what we use, we do have a weekly podcast. It's called Beauty in the Brain. There'll be a link to all of my personal info at the end if you want to get in touch with me. Kind of what we're going to do in the next, in the next 30, 40 minutes is to talk about and to answer your questions on Plexr, this plasma technology that's really cutting edge, in my opinion, and something that can be used in many practices, and how this compares to technology that's tried and true. So we have the CO2 laser is what we're going to be comparing it to tonight. And any of you guys that have been in the aesthetic space, or if you're in derm or plastic, you know that still CO2 lasers are considered one of the gold standards when we talk about skin resurfacing, when we talk about, textural abnormalities. CO2 lasers can really do a whole host of things, and they've been around for a long time, and so they're well studied and well published. And so it's something that often when we look at new devices, whether it's a plasma technology or other wavelengths, that you'll hear these devices are compared to. And so I think it's kind of confusing sometimes as an end user or a consumer of the technology. How do you decide which technology you're going to bring into your practice, which will be able to generate the best results for you and your patients with the least amount of side effects, and also generate a profit for you so you can maintain, a business and perform the treatments that you love to perform. So we're going to talk about the actual technology between the two different types of devices. We'll go over some of the clinical benefits or clinical indications for these devices, how they're used for approved conditions and in some off-label fashions, and the outcomes that can be expected. Specifically, we're going to talk about today how these are used in aesthetic applications. Now, both devices can be used for a host of medical conditions. So any of you that have, primary practices, primary care practices, or surgical practices, you may be familiar with using these devices for other indications that may be more medical or surgical. And certainly we can answer questions about that. The presentation is going to focus more on the aesthetic applications of the devices. We'll talk some about the safety profile of both Plexr plasma device and CO2 lasers in general as a whole. I'm not going to talk about any specific brand, what the recovery profile looks like when you have treatment with these devices, and then kind of a general comparative analysis of what it takes to bring these into your practice, what some of the safety regulations may be, and what some of the considerations that you should ask or at least think about before you decide on a major purchase of either type of device. So first of all, this is just some of you are on here with us. I noticed some names. You've been on multiple webinars. And so this is a bit of a review. Another group of you are new. And so I want you to actually, I'm just going to briefly go through what the Plexr is, what it looks like, what the device is, and how we can bring it into our practice. So you can understand as we start talking about CO2 lasers, some of the differences that you may want to consider. So this is just a picture you see over here on the left side of the screen. It's your Plexr Plus workstation. So this is a workstation. It has 3 hand pieces here. We have pretty much a low, medium, and high energy hand piece. Each of those hand pieces can work independently of the other hand piece. These are all charged and programmed through Wi-Fi. And so we basically take the handpiece that you see there in the middle, one of those 3 hand pieces, they go in those slots in the machine, and that is how they charge. Once they're charged, you can work continuously with them for 4 to 5 hours before they need to be recharged, which if you think about that amount of time of continuous use, that is a very long time. So we're usually doing procedures that only last minutes, not hours. And so we can do many, many procedures. Often these can go for days without needing to be recharged. And they don't have to be attached to the base station to work. It's always a little bit of a fun fact that I share with groups when I talk. I was just in New York this past weekend, and what did I have in my backpack is one of my Plexr handpieces. So oftentimes I'll take it to the weekend with me, and I'll do a quick Plexr shower on myself before the weekend just to give my skin a nice glow, so I'm looking good for the weekend. So literally I can be thousands of miles from my office with the handpiece, and it will still work as long as it's charged. Obviously I can't change the settings on it, because the only way I change the settings is to put it in the base station. And then also we have a smoke evacuator. So if we're doing more ablative procedures, we may need to use a smoke evacuator with that. So you can see it's pretty, convenient in terms of size. It doesn't take up a big footprint on your countertop. And the hand pieces are really very easy to put in your lab coat pocket and take from treatment room to treatment room, or throw in your backpack and take on a trip with you. So what is nanoablative pure Plexr plasma generator? So this is, again, a picture of the device. This is made and distributed by GMV. You'll get this from Med Results. They're your distributor here in the US. So this technology has been around for a while. And there are a lot of other, I would say knockoff devices. And as Jeffrey politely, said earlier, it often gets lumped into a similar category as plasma pens. But in fact, many of those devices are not generating true plasma at all. They may be just an electrical cautery device causing a burn. And as we talk about plasma, I think you'll start to understand why it's important that you understand the type of device that you're using and what gives the Plexr a safety advantage over many of the other devices, such as an electrical cautery unit. So when we talk about plasma, we look at the states of matter. And so we have solid, liquid, gas, and plasma. So plasma is going to be our fourth state of matter. And it's basically ionized gas, as you can see here on the screen, that consists of charged particles, ions and electrons. So Plexr, the Plexr device in particular, is going to use atmospheric nitrogen to produce plasma. So it's not characterized just by temperature alone. And I want to be very clear about that, because when people think about plasma, they think this is something really hot. When we think about our, solar system or what's around us, something that's very typical that we think about plasma energy is sun, right? So the sun is one big ball of plasma. And so we're having to find ways to deliver this energy into a specific tissue. And so, depending on what we're working on, so we can work on the face, on aesthetic things like brown spots or lesions. We can do this to stimulate fibroblasts. And as you guys will see, we have an exciting webinar coming up in a couple of weeks on vaginal rejuvenation. So we can work, in tissues, mucosal tissues. We can work inside the eye, actually on the ocular surface with this device. And so as we talk about plasma being this fourth state of matter, and you look at the bottom of the slide, you see the temperature of plasma can be up to 20,000 degrees Celsius compared to lasers, which are only around, at the most 300 degrees Celsius. It seems on the surface, at least, that something generating this much heat would be very detrimental and would have a much higher risk profile than lasers that are heating up things to around 300 degrees Celsius. And so, when I first heard about this, I was very hesitant and very reluctant. And in fact, the first time Arash had me even try a Plexr shower, which is more of our non-ablative, a little bit more gentle treatment that we perform in the practice, I was pretty hesitant to have this done. And I was mostly hesitant because I had seen results of more ablative treatments with the devices that look very similar. And it's difficult for our naked eye to look and tell the difference between something that is creating a burn or an electrical cautery type of device versus something that's generating plasma, and which we're going to talk about how plasma works. But when we look at that, they both look like a spark coming out of the end of something that looks like a needle tip. And I had seen many people in our practice that had had some sort of pigmentation problems after similar devices. But as Jeffrey mentioned, I looked online and I would see they would come to me and they said, oh, we were at so-and-so and we had this procedure, and it would be a location, a salon or a med spa close to us. And some of the devices they were using were things you could buy off of Amazon for really pretty cheap prices. And the more I looked into this, the more I realized that they were using electrical cautery devices that was causing these specific burns. And so when I was talking to Arash and doing some of my own independent research on the Plexr device and how it generates a pure plasma, I was like, what's different about this? And if this temperature is up to 20,000 degrees Celsius, shouldn't I really be even more concerned about pigment problems than less concerned? So to take a step further and let him actually try this procedure on my face, I was quite hesitant, but then I was really impressed with the results. And obviously I'm speaking for them now a year later. So maybe even longer than that now. It's probably about a year and a half at this point. But when we look at Plexr and we really look at what it is, so I hope you guys kind of understand that plasma is this fourth state of matter that this device is generating, and it's doing this by atmospheric nitrogen and ionizing the gas from the atmosphere. But when we look at how it really works, there's a couple of different things that we can do. So we can use this with different strengths. So that is our different hand pieces. So by choosing a different hand piece, we can deliver a low, medium, or high strength procedure. But as we talk about this and compare it to CO2 laser, often what we're doing is comparing our ablative procedures. So the ablative procedures that we're doing with our Plexr device is the ones that are a little bit more aggressive. And so they do require a bit more downtime, but they're also the more dramatic results. So they're when we're going to see more lifting. So we're not going to talk about just rejuvenation or a skin glow. We're actually going to see tissue that is either removed or it is tightened and lifted. And so we don't see that with a lot of other devices on the market. We see some pigment changes or overall skin quality improvement, but we don't see actual lifting. And so with this device, we can do that. But you should be thinking, how do we do this? Because we're not actually using any kind of surgical procedure or surgical sutures to remove tissue and to reposition that. And so when we look at Plexr and how it works, we're doing something called sublimation. And so sublimating tissue, sublimation in general is where we're going to transform a solid tissue into a gas immediately. And so it's going to effectively remove the tissue in that targeted area where we're performing this. And so as that tissue is removed, basically that area has to heal. And through that healing process, we're going to get lifting and tightening. Now, it's important to note that that's the general concept of how this works, but it's very, very crucial that we apply this energy and that we sublimate this tissue in a very specific pattern. This is not just a random pattern where we're putting dots on the eyelids or on the neck or on the jawline or the nose. We're actually doing this in a very well thought out and well designed pattern. And we include that with your training. And I've had the privilege of filming some of the training videos. We were looking at some of them earlier today. They're going to be released soon. So you guys stay tuned on the Plexr information. You'll see some of the training, but we'll talk about how we deliver those patterns. I don't want to focus on that a lot tonight. I just want you to know that it is a specific pattern that we use to create this lifting, which is something that oftentimes we may not be able to accomplish with our CO2 lasers. Now, I want you to look at the middle of this, and we talk about redoing some of these slides. This one is used often in our presentations, but even earlier when I was talking to Jeffrey today, I said, I really think that this captures, to me, the essence of what this product is doing. So as you think about applying heat, if we apply plasma energy up to 20,000 degrees Celsius, and we're sublimating that tissue, so we're moving it from a solid state into a gas state, it is like taking this log in the middle, applying that heat to it, right, or that plasma energy, and we immediately vaporize it. So it moves over to the left. It becomes smoke. It's gone. There's no log left. There's no tissue left. And through that immediate destruction of that tissue, because we're turning it into a gas state, there is not heat energy there in those more superficial cells. So when we're talking about the skin in particular, we're looking at, kind of more the superficial dermis. And that area is where, we can run into some pigment problems. If we deliver too much heat in the epidermis or more superficial dermis, that's when we're going to get some pigment issues that we could deal with over time. Now, as we look at other energy-based devices, so when we start talking about CO2 lasers in particular, we are delivering a fair amount of heat. Remember that up to 300 degrees Celsius that we talked about earlier on that first slide? We're delivering that heat into the tissue, and we are causing thermal damage. So the way we're not causing thermal damage with our plasma is we're removing that tissue. So yes, there is thermal energy, but it is removing the tissue. So the tissue that we apply that to is now gone. Whereas with a laser, we apply it and it's not enough heat to actually remove the tissue altogether. We will create holes in the tissue. We may deliver the CO2 in a pattern based on what our handpiece looks like, but it really heats up that area around it. So we have to be super cautious with the skin type, so the Fitzpatrick type of patient and the protocol. And then we have to be really cautious with a lot of our settings. And that would be like looking in this situation, and it's where we apply fire to this log. It's not enough to make the log totally disappear, but it will dehydrate the log. It will take a lot of water out of that, and it will turn it to something like charcoal. So we haven't removed it totally. That tissue that's left behind, or in this case, if it was the log, the charcoal that's left behind, that area can now be irritated from that heat. And that is where we may get increased melanin production, or conversely, we may have that area depigment altogether. In that, circumstances, permanent hypopigmentation, and we'll show you some examples of that. Now, this is another pictorial graphic, and we do show this a lot. I just really don't know that there's a better slide or a better way of showing this. So you see, as we're applying the plasma energy, it's going in this very superficial part of the epidermis and removing wherever we're applying the energy. And this is using the device to harvest and to create plasma from nitrogen in the air. Now you see that compared to something like an RF microneedling on the side, but this would be also very similar if we did something with a CO2, where we're pushing that heat energy deeper in. And so depending again on which device we're using and what the chromophore is and a lot of other factors, it may be a little bit more superficial in the epidermis or, a little bit deeper into the dermis, but we are applying heat energy. And where you see in that area of light versus dark gray, if you look, there's a very thin line with the Plexr, and we have a very thin line of necrotic tissue that's going to come off after we ablate that area or sublimate that area. And then we have a very, very small area of tissue that may have thermal damage. Compare that with our RF needling example. And again, this will be similar to what we would see with CO2. You have a much larger area of necrotic tissue and definitely a much larger area of tissue that could be exposed to heat injury or have thermal damage. Now, when we look at Plexr, it's indicated by the FDA for removal and destruction of excess tissue. And where we see it, other things that we use this for often or other clinical indications that we may use this would be for things like soft surgery, so blepharoplasties, upper and lower. We could use this for the barcode lines or the deep smokers lines for acne scars. We could do it for neck lifting, so it's a really saggy tissue that we can see on the neck. Nose contouring, lip contouring, fixed asymmetries, and stretch marks. Now, what you're seeing here is an example of a semi-ablative treatment with the Plexr. So this is the actual Plexr in use at my office. And this is a demonstration of using this in a ablative fashion for hand resurfacing. And so I want you to notice that basically we are sublimating this tissue and we're doing this. There's different patterns we can use, and this we're using a zigzag pattern. We're doing this basically for speed. So this entire procedure will take us around 15 to 20 minutes to do with the hands. And then we're going to have, significant injury with healing over the next week or so. Now let's move and transition to talk about CO2 lasers. And so this, you'll see a video of a CO2 laser in use. Again, this is at my practice. This is a CO2 laser that we have. Now this is using one of the devices that have an automated handpiece. And you see that it's basically scans the hand, and the CO2 is creating these micro injuries throughout the hand. It'll scan it and it'll do the whole hand. It's pretty quick. Again, it's about a 15-minute procedure. So this is, an automated device, but if it wasn't, I would have to sit there and make all of these individual passes, by hand. But this is a laser that has a beam of infrared light that's a more, and we have that red that you see on there is actually just an aiming beam. Like normally we would not visibly see the CO2 laser. That is just a beam that helps us know where this is going. And then it has a wavelength of 10,600 nanometers, and the chromophore, or its target tissue, is water molecules in the skin cells. So it's readily absorbed by water molecules in the skin cells. So when the laser beam hits that, it'll vaporize that water. And as it vaporizes it, it causes some controlled damage in the epidermis, and that is called ablation. So this is an ablative type of therapy. And depending on how we set our device, we can be more or less aggressive. So we can ablate more or less tissue. Now, I told all of you guys that my very first device that I purchased was a CO2 laser. And at that time, we couldn't really adjust a lot of things on it like we can now. And so it was pretty aggressive. Now we can adjust some things a little bit and we can be less aggressive with it. We don't have to ablate as much of the area. But one of the reasons it scared me, and one of the reasons I think it was a bad business decision, is it was aggressive. The healing time was significant. We were talking about weeks that people had to keep something on their face like an aquaphor or some sort of occlusive type of dressing. We had to deal with things like, infections. We had to make sure they kept it really clean as they tried to regrow new skin. And so people that we could get through that healing process, they would have, beautiful results. They would have, perfectly smooth skin. We did deal with some pigment issues along the way. But I found that patients didn't really like that, especially people who were coming into a med spa. They thought this was too aggressive and that they didn't really want the downtime associated with it. We also live in Florida in a coastal area, so there's a lot of sun exposure. And so patients didn't particularly want to be out of the sun for the recovery period. And so we see that as that CO2, you just saw the example in the video, as it's, ablating that tissue in the hand, it can create quite a bit of thermal damage. And so through that process, we will get collagen production and remodeling through that wound healing. But the more aggressive we are with that laser to get a more dramatic result, the more heat damage and the more likely we're going to have some sort of, complication from that. Now, interesting enough, I just read a report and they were talking about some of the top litigated cases in aesthetics over the last year. And, I think 4 or 5 of the top 10 were all related to laser therapies. Most of them were laser hair removal. So I'm not going to clump CO2 into that. And most of them were by providers who probably were not properly trained in the use of the device. And so without getting into the specifics, I just want to point out that lasers in general can have some significant risk associated with them if you're not properly used and training them. So while we think about CO2 as being the gold standard in terms of resurfacing and remodeling, that's because this has been what is studied and been around for a very long time. But now with newer technology introduced on the market, we find that we can get very, very similar results with significantly less downtime. So when we look at this and look at some of our safety considerations with using one over the other, the Plexr is generally associated with lower risk of long-term pigment changes. So I can tell you that in our practice, we have never had any long-term pigment changes associated with the Plexr. Now, we can debate about some of what we consider long-term. We have had some patients that's had persistent redness for, a little over 2 months. We had one patient in particular that we were really aggressive with an area with the barcodes around lines around her mouth, and her skin is perfectly smooth. She has beautiful results now, but it also took around 6 to 8 weeks for some of the dark areas to start to fade, and maybe it was a little over 3 months before the pigment was totally back to normal. But this is not permanent, and so that is the longest we've had anybody with pigment changes, and we use Plexr every day. There's 3 providers in the practice that are using it every single day, and it can be used on all skin types. So we do use it on Fitzpatrick 1 through 6. We do adjust the strength that we use on some of our higher Fitzpatrick, but we absolutely use this on all skin types in our practice. When we look at CO2, we again have used it for a very long time. And in our first CO2 device that we purchased, we did not use it on anything higher than Fitzpatrick 3, period. And so we had automatically excluded Fitzpatrick 4 through 6 on those. With our CO2 that we use now, we actually do use it on patients who are a little bit darker skin types with significant safety precautions in place. With some of the things that we have to look at, it's not just hyperpigmentation, but there are some worries about depigmenting, which you can see an example here of depigmentation after a CO2 injury. And that may have to be managed with things like, like a permanent makeup tattooing, because you will not get pigment back in those areas if you have that side effects. When we look at recovery time, the Plexr is significantly shorter. We see that the healing time is somewhere on the more aggressive treatments up to a week, which would be usually around 2 weeks for a similar level treatment on a CO2 laser. After CO2, if you look up a lot of things with this, you will have persistent redness in that area. And, 3 months is pretty commonly talked about, but we've seen patients up to 2 years with persistent redness after really aggressive CO2 lasers. This is from our practice. This is an example of a Plexr upper and lower blepharoplasty. And so we were, fairly aggressive. And this is 1 day after treatment in the first photo versus 5 days in the second photo. And so, the patient is from out of town. So she hasn't been back. I think she'll be back in maybe 2 months. She usually comes about twice a year. So I'm trying to think of where we are in her time frame, but she'll be back and we'll give you, her final after photo. But this is the last one that we had, was 5 days after treatment. And you can see that with a CO2 laser of a similar level, we would have had at least 2 weeks of healing for this. Now, the other thing I want to disclose here, we did use exosomes on this patient topically after this treatment, which also may improve the healing time. This is an example of a CO2 laser, and you can see 5 days after this. Now, this is not my patient. This is another patient that blogged about it. She's a blogger, and she posted online. This is my personal experience. So, Jeffrey, you didn't know you're going to see these photos. This is after a CO2 laser, and this is around a week afterwards. So you can see it was quite prolonged, quite significant. I had a fair amount of facial swelling and edema, and I was very scared that I was going to have permanent pigment changes from this. And so, again, the healing time, we never have had anyone
This is
look
like
like
Chris, this is like a poster from Deadpool.
yeah, we never had I would have a heart attack if this was
Yeah.
so for myself, I can get through it, but if this was a patient, I would have a heart attack, and we've never had anything close to this with our Plexr. This is looking at one of our Empire instructors. Some of you guys may have had him, Dr. Triboni, and this is after his Plexr lower blepharoplasty. And so you can see, great results. He healed pretty quickly from this. And it was interesting because in this photo, he really didn't even, from what Arash told me, think that he had very great results. And then, when you look at his pictures, you can obviously see that the bags and the lower rise is significantly improved after his Plexr treatment. We have a study here, and so this is not just looking at before and afters where people question, the photos if they were altered or photoshopped. I can assure you that mine have not been, but I know, that does come up sometimes. But when you look at this, this is using confocal microscopy to study the effects of plasma energy, and so this is looking at a upper lid blepharoplasty, and they have two patients here. The upper side is patient 1, the lower side you'll see is patient 2, and they have two different time points that they looked at this, and those bright areas that you see on this are actually collagen production. And so we can see that after plasma, this is using the Plexr plasma generation device, that we have sustained results. And so this is going to show that you can have long-term collagen production and neovascularization from use of the Plexr. So when we look at these two devices, and I want to make sure that we'll kind of wrap this up so we give you guys enough time for your questions. But we see here on one side our Plexr plasma, it's plasma energy. It's a microplasma that arcs and sublimates the tissue. So it uses plasma energy to remove the tissue. Remember, it vaporizes and it's gone. There's minimal thermal damage to the surrounding tissues. So it's basically delivered exactly to the tissue that we want to remove or sublimate, and it's minimal thermal damage around it. CO2 is using a wavelength that's going to have water as a chromophore. It's using carbon dioxide gas. It vaporizes those water molecules, and it can generate significant heat and thermal damage to the surrounding areas. So when we talk about why that matters with the plasma energy, we have a shorter downtime with healing under a week. CO2 can be significant downtime, healing up to 2 weeks with prolonged redness. We can use plasma on various tissues, including anything in mucosa, cartilage. We can use it intraocular, intravaginal. We can also use CO2 on some of those tissues as well. And so you'll see that there are CO2 uses in mucosal areas, such as in the vagina. That's somewhat common. Plexr is suitable for any Fitzpatrick type. The CO2, you're going to be really cautious, especially with your Fitzpatrick 5 and 6. And Jeffrey, with that, I think we have about 10 minutes.
Awesome presentation. That was really, really insightful. I learned a lot. Thanks for sharing those pictures. A little bit
Yeah.
of insight
See,
into your own.
that one I don't share a whole lot.
Behind the camera. So there's a few here. First question is, what are the consumables with Plexr?
Oh, great question. So the consumables, those tips that you see, they're around $10 to $20. I think they're $20 now for all of them, right? And so we don't have any that are different price now. So I think they're $20 for all the tips now, whether they're the shower tip or the needle tips. Jeffrey, correct me if I'm wrong on that, but it's pretty cheap.
Yeah, super cheap. Super cheap. What are recommendations to decrease the risk of hyperpigmentation after the Plexr ablative treatment, like the blepharoplasty or dark spot removal? Will the use of topical steroids help to accelerate recovery?
I'm not aware of any data that use of topical steroids will accelerate recovery. I don't recommend that in my practice. I think probably first and foremost is making sure that you optimize the patient prior to the treatment and using the right energy selection, and the proper post-procedure care is going to be paramount. And so I can tell you that it was interesting because now that I have a more trained eye, I can look and tell some differences with the energy without looking at the actual handpiece that I'm using. But early on, and I had this discussion with Arash, the president founder of Med Results. Many of you guys know him, and he said you can absolutely tell a difference in the handpiece that you're using based on that spark. And I said, no, it looks the same to me. Like if I'm using low, medium, or high, it looks the same, and I can't really tell a difference in the energy. And I think being in the space for a long time and using a lot of energy devices, I thought I needed to use a higher energy to get the great results. And so I was really using the highest energy handpiece on most conditions that I wanted to be more aggressive with in many patients. And what I found over time is we don't need to do that. We're actually getting phenomenal results with using the low, medium, or high. It looks the same to me. Like if I'm using low, medium, or high, it looks the same. And I think being in the space for a long time and using a lot of energy devices, I thought I needed to use a higher energy to get the great results. And so I was really using the highest energy handpiece on most conditions that I wanted to be more aggressive with in many patients. And what I found over time is we don't need to do that. We're actually getting phenomenal results with using the appropriate hand piece, so we don't have to be that aggressive. And once I kind of made that shift and switch, I wasn't dealing with these pigment issues. And I told you guys the longest I've dealt with is it was around 3 months, but it was significant improvement by the 6 to 8 week mark and really gone totally by 3 months. So I haven't had anything longer than that, even with using the highest energy handpiece. So I think that's first and foremost. So sun avoidance, sun protection. And so I really don't like to do this. I tell them to try to stay out of the sun at least 2 weeks before, making sure they're not on any tanning supplement. So the melanotan injections or anything off of that. And then afterwards, they need to be diligent about their sun protection for a month. So those things are important. Step two, if like you've done all of that and you're still dealing with some pigment problems, don't do anything more inflammatory to try to speed that resolution. And so that's the other thing that I think from talking to people who's used a lot of energy devices, when they have a pigment issue, they want to resolve it quickly. And so now they jump to other things that can be inflammatory. And remember, if you're dealing with any sort of pigment change, after an energy-based device, a lot of that's caused from inflammation. And so the last thing we want to do is a second treatment that can be inflammatory as well. So I don't do things, even things like microneedling in that area. I avoid that because those are things that can be inflammatory by nature. If I'm trying to resolve that, let's say that it's persistent and it's staying there, there are things that I will do with the Plexr device. And so this is usually going to involve the Plexr shower. So this is going to be Plexr shower, opening up micro channels. And through that, that's going to enhance my topical delivery of some sort of product. And so I don't really care. We have a great line of products that you can use in conjunction with your Plexr, some of them that have lightning agents in them. And so I'm using some sort of agent in my practice with the Plexr shower to try to speed that up. You could even do it with like things like your tranexamic acid, and that will speed up some of that resolution of the dark spots. Again, I really encourage you not to do that, to let this process, it will improve. But if you're at the 3 or 4 month mark and you've had some pigment changes, which is very rare, then consider doing something with your Plexr shower and using a topical that's going to be used for skin lightening. So something, maybe with some of your Arbutin or your lightening agents and hydroquinone, tranexamic acid, any of those things that you could use.
All right, there's a bunch more questions coming in. There's 2 questions related to what we just talked about is afterwards. The best post-care treatment recommendations, any specific products, topicals, all of the above.
Mm-hmm. Yes, so as part of all of our Plexr treatments, we include the ActiveFeel line of products as part of our post-care. So ActiveFeel is a line of products. We have ActiveFirm and ActiveReverse. And so ActiveFeel is kind of like the parent company, if you will, and it has multiple products under there. And so basically, they're a hyaluronic acid-based product. And so something that we can apply topically. But they work on stimulating the CD44 signaling molecule, which stimulates collagen production. And so I do find that we get our most impressive results when we're using this line of products for our post-procedure care because of the long-term collagen production from that product. The ActiveReverse specifically has vitamin C and glutathione in it, which is really good to minimize pigment changes. So anybody with any kind of pigment, even if it's freckling or dark spots or uneven skin tone, I'm using the ActiveReverse in my post-procedure care. The other thing that I've really been toying with, maybe just over the last 4 to 6 months, is I'm combining my ActiveFeel products with exosomes, topical exosomes. And I've tried plant-based and some human-derived and some synthetic-derived. And I'm actually combining that. So I know that I've talked to, Arash, and we're talking about, looking at different lines of exosomes and what's effective, and maybe incorporating some of that into the MedResults family. Right now, it's something I'm using from another company that I'm using with the ActiveFeel line of products, and that combination has been pretty impressive with the results I'm seeing. So for those of you who want to look into that, I'm happy to go over those protocols at another time. We do have a new exosome class where we're teaching a lot of that at Empire. So there's a lot of different references, or, reach out to me on social media, and I'm happy to kind of let you know resources to learn more about how I'm combining those therapies.
Yeah, and we do have a line of exosome products coming out soon. So that is
Excellent. Excellent.
stand by. A few more questions. One, let's stay on the device for a moment.
Sure.
Any experience changing, or what's your experience changing settings to decrease or increase energy? We talked a little bit about that. And then any interference with things like Botox or filler?
Mhm. So no interference with things like Botox or filler. If I'm going to do this in the same day that I do it with Botox, I do this treatment first and I do the Botox afterwards. I usually do Botox at the end of whatever procedure I'm doing. Really, I just don't want to be pressing on that area, moving that area, anything. But there's no interference with that. In terms of the filler, it's going to be at a deeper level, and this is not creating thermal damage. It's definitely not going to, denature the filler or make it dissolve more quickly or anything like that. So you certainly can use combination therapy. I love it. In terms of the energy levels, that is going to be based on the handpiece. And so the handpieces themselves are what delivers the energy with the Plexr. So you're not going to dial that up and down. The countertop device that you saw that they charge from, that is where you will change things like if this is delivering constant energy, pulsing the energy, or fractionating the energy. But the actual energy itself is going to be from the handpiece. It's going to be a white, a green, and a red handpiece. And that handpiece is what you will choose to deliver that energy. Then you can do things such as how long you hold it on the skin, the type of tip that you use. If you use something like a clothes hanger type tip, the energy is going to be much more dispersed and less than if you use a needle type tip that focuses that energy.
Cool. Awesome. Anesthesia is not required for the Plexr. I could answer that one myself. Let's, well,
Well,
except for there are certain, right? There are certain
no, no,
protocols.
no. So I think that maybe you're interpreting that a little bit differently than what the provider is asking. General anesthesia for sure is not, but the numbing cream is considered anesthesia.
Mm.
And so
Oh,
we do use numbing cream, or a topical anesthetic is what we use for our ablative procedures. For the non-ablative or the Plexr showers, we actually don't numb for that. Some patients like it and may ask for it, but in general, it's not needed for the Plexr shower. For our semi-ablative, more like our cat resurfacing procedures, and definitely for our ablative procedures, we need some sort of numbing. So whether it's a topical anesthesia, or if you were providing anesthesia by doing something like a nerve block, you could certainly do that. It's not really necessary. Topical is usually more than enough, but we do need some way to anesthetize the area, and it does not require general anesthesia.
mhm. That's where my mind went.
I know
Really.
that's where your mind went.
I was like, imagine putting somebody out with the
No,
Plexr.
no, no, no. Yeah.
Okay, here's a more of a general one, taking like more of a 30,000-foot view. It's what is the main reason you would recommend a spa or clinic to have the Plexr device?
So one is going to be the range of treatments that you can offer. So that would be the number one reason I would recommend that they have it. And then really, close behind that is going to be how this can impact your bottom line. It's really, something we could talk about, and maybe we'll do a webinar in the future on this to talk about the business end of things. But what you'll realize quickly when you do the math, and I go over this a lot with the business classes that we teach, is that it's nearly impossible to replace an income of any medical professional with Botox alone. It's not impossible, but it is nearly impossible. It is a high volume of patients with a very low return on investment because the products are so incredibly expensive. And so with something like the Plexr device, you're able to now do procedures that are going to give the patients the results that they're looking for. You have a much better return on your investment. And so as we look at energy-based devices in general, many of you guys know that they're going to be $100,000, $200,000, $250,000 for some of these devices. And the disposables to use them is quite expensive. So sometimes it's as much as $1,000 per treatment. And so there's an energy-based device I have in my office, and literally for me to do that particular device on the face and neck, it cost me $1,000 just in disposables. Now, one of the things I like to point out is the device itself is an asset for your practice. And so, yes, you have to pay for that, right? Just like you pay for your car or you pay for your house, but you own those, and they are assets that you can sell at some point. And, just like a car, devices do depreciate over time. You will take that depreciation as a tax benefit, but this is an asset that will generate you money for your practice. And your disposable cost, or your actual per patient treatment, is only $20. Right now, if you put topicals and all that, that adds into it. But the actual device, the part that you need to treat each patient, is only $20. These procedures, start anywhere from $300 or $400 and up to several $1,000s. And so this is where you can really change the trajectory of your practice and go from, like I did, seeing it as something as a very part-time vacation fund, I don't want to lose money, to seeing it as, wow, I can actually scale this. This is actually something I can be more profitable than I am in my other career. It is something that I can use as an asset to generate profit and do more of the other things that may not generate as much profit, but I'm passionate about them. So I love doing, IV therapies. It doesn't make a ton of money, but I can't do that all day long and keep my practice open. And so it gives you the ability to do that. So first, and everything I do in my practice is safety. And so it is safe. I can treat all patients, Fitzpatrick 1 through 6, and I can do a variety of conditions. So I can do something like a lunchtime facial to give them a glow for that weekend and more collagen production over 4 to 6 weeks. I can do something a little bit more aggressive that they're going to have more results, but they need a few days to recover. Or I can do something really aggressive like a non-surgical blepharoplasty and give them an amazing result, but they're going to need around a week or so that they're going to have to heal from that. And so those are all things that I can do now in my med spa to give me a range of treatment options for my patients and be profitable at the same time.
Good, solid answer.
Mhm.
Can we keep going? Or are we
Yeah, I mean, yeah,
we're
I'm
okay?
fine.
Okay, cool.
Yeah.
Well, we talked about, for anyone who's wondering about the cost of the device,
Mhm.
please we could book a meeting here. This is a QR code. I'm also putting my email in the, let's see, I'm going to put this for everyone to see. We had questions about costs. We're hosting in-person trainings at the office. So if you already have a device, just shoot me an email and I'll send you the dates we're hosting in-person trainings. We just actually acquired another office space in our building. That's going to be our Age Reversal Academy studio just for trainings. Mark your dates for September 14th. We're actually having an entire day workshop on Plexr. So that's open to customers, people who are thinking about the device. It's going to be in Los Angeles. We're also having another one in October and November, but the first one is September 14th. So mark your calendar, shoot me an email if you're of any interest. And one question asked about, Merrill asked about the videos. We also have a whole video library of live trainings coming out. So a lot of fun stuff coming out for summer months, for July, August months. A few more questions while we still have time. Another one is, how much can a Plexr treatment be charged? I know this is a very geographic question, so
Yeah.
I'll let you cover that one.
Yeah. So again, I love to talk about this. When I was in New York this weekend, we did a 2-day blueprint for business seminar, and we have a whole section in that class with Empire that we just talk about pricing strategies alone. So there's so many things that go into that. So region is one of them. So you need to know what's common in your region. What I charge in kind of Northwest Florida and Southern Alabama is very, very different than what's charged in Beverly Hills or in Manhattan. And so those ranges are, hundreds of dollars different. So in general, I will tell you that even the lowest priced areas are probably doing somewhere around $250 to $300 for some of their Plexr shower, which is the non-ablative treatments. And so again, if you think about a $20 disposable and a $250 procedure, and that's usually performed by, it depends on scope of practice, all estheticians, to prices in the several $1,000s for some of the soft surgical procedures, so like $2,000 to $3,000. So we give you from Med Results a kind of price range, and so kind of some average prices to help you with that and help guide you with that. But the lowest end of that is going to be $250 to $300 for a procedure that takes 20 to 30 minutes. And the highest end for that similar type procedure, and I think probably what you're seeing in more like Beverly Hills and some of the Southern Florida areas like Boca, is going to be $600 to $700 for that same procedure. And so, there's a strategy behind it. And in our blueprint class, we kind of talk about let's figure out what it costs you per hour to keep that room open. And so there's a lot of ways that we calculate that, and you can divide that to the number of rooms you have in your practice. And so you can add that in, and then you can add your disposable price of $20 in for this particular device use. And then you can look at average in your area. And if you're the only one doing it, you can kind of put that price where you want it. If there's 10 other people doing it in your area, you got to kind of know what they're charging and make sure that you price yourself competitively. And so we help you with that through our courses with Empire, but also through Med Results. I'm around to help you with this. Arash will help you. Jeffrey will help you. We give you some average prices, but regardless of any of those ways you figure out how to price it, the thing about it is that your disposable price is so low that it gives you ability to really kind of be flexible with this pricing. So I had, I think I told you this, I had no problems with the ablative treatments in my practice because it's like surgical type results and people were used to paying those prices. But with the Plexr shower, people were a bit hesitant. And how did this compare to microneedling? And why were they going to pay more for this than microneedling? And so although I put a high price on it, I had to go back and adjust that because I was having trouble with that. Once I started getting results and showing results, then people didn't mind paying. But I had to adjust my price down on that shower to start with. What I loved about it was I didn't have such a huge disposable cost that I was going to be losing money to do that. I still was profitable, even adjusting that down.
Awesome. Do we have time for a few more questions?
Yeah.
There's more in
I see a
Q&A.
quick one here that I'm going
Yeah.
to answer this that was in the chat on Pronox and plasma sparks and fire risk. Always, anytime you're using any sort of enriched oxygen source, so anything more than room air, and Pronox uses a 50-50 nitrous oxygen blend, and so that's obviously that combined with sparks can be a fire risk. So we don't want to negate that, and we want to be aware of that. But usually where we're concerned with that is when we have free-flowing oxygen into the environment and it's an enriched oxygen environment that spark is being created in. With Pronox, it is an on-demand system. And so oxygen is not free-flowing. The only time that oxygen is actually flowing is when the patient inhales and they got to have the mouthpiece in their mouth. And so yes, I'm not telling you that it's zero risk, but it's actually pretty minimal because of the way the Pronox machine is designed. I would still have an idea in your mind on what you're going to do to mitigate that. So I'm not doing this under closed drapes. This isn't an open room. It's an on-demand system. I'm going to have some water source available should that occur. With the Plexr, we're using a dry surface, so we're not using a lot of flammable sources. And so we really don't have like an oxygen saturated area like you would have, an alcohol saturated area or something with a prep solution that may be flammable that you would have like in an OR setting. And so very minimal risk there, but not zero.
All right. All right. A few more. How is Plexr different from Elicor?
Okay, so Elicor is going to be, it's an actual coring device. And so with that, you are removing tissue. So this, we're ablating it. We're using plasma energy to do that. With the Elicor, they're actually using a needle. Now, I don't have that system. I have viewed it and looked at it. The principles of healing are very similar, that we're removing tissue either way, and then we're letting that tissue contract and heal. For me, one of the things that I like about the Plexr in particular is that we can remove this in a very selective fashion. And so we're doing this by using certain vectors to create a lift in that vector. I believe you can customize it a little bit with the Elicor, but I don't think you can deliver it quite as precise as we can with the Plexr, because I think it's a square and you can only remove in those square patterns the tissue. There also is some pigmentation risks. So remember, we are going and removing tissue through these cores, micro cores. It's what these needles are removing, and those all have to heal. So those are open areas, and it can create some inflammation around that. And so there are some pigmentation risk as well. So I believe personally they're less, and I can customize the treatments more. The concept of removing tissue and healing and tightening is pretty similar, the long-term effect of those two.
Cool. How about Morpheus and all therapy?
Yeah. So all therapy is the one that so again, They're all different energy-based devices. Morpheus is a radio frequency microneedling device, and I think it referenced back to the slide that I had showing the plasma energy and the sublimation of tissue and the thermal damage. And that little column we showed next to it with the needle going in, that is the something similar to Morpheus, right? It is a radio frequency energy device where the needle goes in, and there's a lot of different ways that the companies can adjust that. Morpheus is only one of them where they can try to mitigate the heat and the thermal damage, but you do have a little bit more risk of thermal damage. It is not removing tissue. It is delivering heat through needles into the tissue to stimulate the fibroblasts and collagen to tighten. With the Ulthera, that is using ultrasound energy, and it is delivering it at a deeper level. And so depending on the handpiece that you choose, it will deliver that energy, 1.5 to 4 or so millimeters deep. We try to target this mass level, and that lifts it. Now, for disclosure purposes, I don't have the Morpheus, but I do have a radio frequency microneedling device in my practice, and I do have 2 Ulthera devices in my practice. And so we've had that for a long time. The Ulthera is the device I was referring to that has really expensive disposables. That is a device that it costs me quite a bit of money and the hundreds or thousands of dollars to do a full face treatment. And so it is just working at a different level, is delivering heat very deeply to create a thermal coagulation point, and as that point heals, it will lift. It does nothing for pigment. It does nothing really at the, when we talk about resurfacing and for scarring and those types of things. So it's pretty effective device in the right patients for lifting, but not for scarring, not for pigment, not for resurfacing.
Awesome. And if you are joining because you got the time zones mixed up, Ari, it's all right. We're sending this video to everyone who registered to the webinar. We house these all on our Vimeo page. I'll also put the link in the chat on all the Vimeo videos that we have so far, so you can see other past webinars. I love this question. We covered it a little bit in the beginning. Is a plasma pen a true plasma device?
Plasma pen is like a catch-all term. And so it is very interesting how many things are called a plasma pen now. And so I don't want to, talk about a particular brand. I can talk to you about Plexr because I know very well about the Plexr device and that it is generating, plasma energy from nitrogen in the air. It is ionizing the gas particles in the air and creating plasma. There are so many other devices out there that use this catch-all term and say plasma pen. And literally, I tell you, buyer beware. Ask questions before you buy any of the sort of knockoff devices, because a lot of them are not generating true plasma. They're creating a electrical spark, and it's an electrical cautery unit. There's even some of these that use batteries that are single use, and they're literally an electrical cautery unit that we may use to cauterize like a nosebleed in the ICU. And it is using heat to cauterize that area. And people are using it to actually cauterize or burn the skin and try to lift that way. And that is where we're getting into problems. And so plasma pen in general, be cautious because there's so many different devices out there. And some of them literally are being bought by non-licensed medical people. Off of Amazon for really cheap prices. And that is where we're seeing a lot of the scars, pigmentation, and it's kind of giving a bad name to anything that looks similar that's creating a spark and creating this type of pattern on the skin.
Thank you. Thank you. I think that is all. You want to check? We're done with Q&A. Just quick browse through the chat. Is a Zimmer or cooling device a good idea for the heat being generated? That is the last and final question, folks.
We have it and we don't use it a lot for this. I guess you could. I don't know. I don't think of a reason why you couldn't use it to help with the analgesics for this. We don't. Like I said, I have it in my practice and we use it for other things. I use it a lot for laser hair removal. I just haven't found it really necessary for this. And so we use topical numbing for pretty much all of our ablative treatments. And I do use a lot of Pronox. And so again, in full disclosure, I do have that in my practice and we use Pronox for anything that's a little bit anxiety provoking or even mildly uncomfortable. I want to do everything possible to make sure that comfort and pain control is like paramount. I think patients come back to you. They're going to like continue to see you. They're not going to be stressed about their appointment if we're doing everything we can to control their pain. But and so that being said, the device sits right there in the same room. It's easily accessed and used, but I don't use it. I don't really. I'm trying to think if I see Jerry or Allie using it, and I don't really see them using it often either for the Plexr procedures.